Hi, everyone. Thank you for coming today and joining us. We have Dr. Kevin Yuen. He is a professor of medicine at the University of Arizona College of Medicine and Creighton School of Medicine, as well as a medical director of both the Barrow Pituitary Center and the Barrow Neuroendocrinology Clinic at the Barrow Neurological Institute located in Phoenix, Arizona. The focus of his clinical practice is on the diagnosis and treatment of pituitary and adrenal disorders, with a particular, I'm sorry, I'm hearing someone in the background. The focus of his clinical practice is on the diagnosis and treatment of pituitary and adrenal disorders, with a particular interest in growth hormone and cortisol disorders. Dr. Yuen was educated in the United Kingdom, earning his bachelor degree in medicine and surgery at the University of Sheffield, and completed his higher training at the University of Cambridge and Oregon Health and Science University in Portland, Oregon. Dr. Yuen is the lead educator for the pituitary section of the fellowship program and has conducted studies on growth hormone dosing and diagnosis studies, long-acting growth hormone formulation studies, and trials with new drug therapies for acromegaly and Cushing syndrome. He has published extensively, authored several book chapters, and is a frequent guest speaker on various topics related to pituitary disorders. Dr. Yuen serves on several national and international committees and advisory boards on pituitary diseases, as well as on the editor boards of several peer-reviewed scientific journals, and is currently actively involved in several clinical research and collaborative studies in acromegaly and Cushing's disease. I want to let everybody know that this program is made possible in part by a grant provided by the Pfizer Foundation. Acromegaly community wishes to thank all that have made education by the experts possible. For this, we say thank you. And with that, Dr. Kevin Yuen, please proceed.
Thank you, Jill. Thank you for having me, and thank you very much for giving me the opportunity to talk about, to give a talk today on this very, very topical subject of COVID-19, as we are all going through this pandemic together, and hopefully one day we can all stand together and say we've gone through this, and we go through this together, and we will beat this thing. So what I plan to do for the next 40 minutes or so is to talk a little bit about how COVID-19 specifically impacts patients with acromegaly. And and this is my agenda. I'll talk about what COVID-19 is about, and a little bit about how the impact of telehealth has had on managing patients and enabling providers to see patients, and also for patients to communicate with their providers in this very stressful time. General risk factors, not only specific to acromegaly patients, but also relevant to pituitary patients, and then also specific risk factors to acromegaly patients, and what to do should you get infected with COVID-19, which I hope none of you will, but if you do, you'll need to know how to manage and what to do and how to deal with this. So I'll start off with what are coronaviruses. And so human coronaviruses were actually first identified in the mid-1960s, and it's named coronaviruses because of the crown-like spikes it has on their surfaces. In a nutshell, there are four main subgroups of coronaviruses, known as alpha, beta, gamma, and delta. And in total, there are actually 7 coronaviruses that can infect people. Sometimes these coronaviruses can infect animals, and they can evolve to make people sick and become new human coronaviruses. And the 3 common examples, as you can see here, are the 2019 COVID-19, as we are going through that now. We had the SARS, and we also had the MERS, which was previously 2 to infections that also occurred again, in the 21st century. So what is actually COVID-19? And as you know, in December 2019, it was first identified in China and has rapidly spread, resulting in a global pandemic, which the World Health Organization has designated the disease as COVID-19. As you all know, it's very infectious, and to date, there are no specific vaccines that we have that we can treat effectively, which is why social distancing and avoidance of getting infected is crucial. So how does one get infected with COVID-19? Well, I'm going to take you through step by step of how a person gets infected. Typically, a person who is infected with the virus expels the droplets, which contains a lot of these viruses in the droplets, which hangs around for a few hours. And another person comes along and inhales the droplets, typically through the nose and throat, which is why the recommendations of putting on a mask has become so important, because what we are trying to do is we're trying to reduce this step here of at least reducing the possibility of another person inhaling those droplets, which is why the mask acts as a barrier to actually reduce that possibility. But let's just say if the infection gets into another person, it finds a home in the lining of the throat and the nose. And typically viruses like that like it because it's nice and warm, and it facilitates itself to attach to these cells, which are rich in what we call ACE2 receptors, or angiotensin converting enzyme 2 receptors. Now, it's important to note that these receptors are actually present in many parts of your body, which is why, as you know, COVID-19 affects many parts of the body. So by attaching itself to this receptor, it's kind of like a lock and a key, and the lock being the ACE2 receptor and the key being the virus. By turning that receptor, it enables itself to enter the cell. It hijacks the cell's machinery and makes many copies of itself. So in the early stages, you'll find that the symptoms are actually can range from being very variable to some patients will tell you they may not have many symptoms, to those who can develop severe symptoms. But the classics and the important ones to take note would be fever, cough, and shortness of breath. And just like any other viruses, it's no different. You can have muscle fatigue, muscle body aches and fatigue, headaches, sore throat, congestion, and runny nose, which I'm sure many of you can relate to because of the fact that you probably had, say, the flu in some time of your life. And it is at this stage where the immune system, because of its entry into the body, is triggered. It triggers the immune system, and the immune system then has to fight off this virus. But if the immune system fails to beat the virus, and this is why you may have read that patients who are immunocompromised, they are susceptible, because if the immune system fails to fight the virus at this stage, the virus then continues its path, its relentless path down the windpipe and attacks the lungs, whereby there is a war that goes between the immune system and the virus. So just like any war, what you will find is that there's a lot of collateral damage. So the collateral damage is in the form of inflammation, and inflammation triggers a lot of fluid, which has a lot of inflammatory cells, which then gets deposited in the lungs, particularly in the alveoli of the lungs. And this causes a reduction in oxygen transfer, and therefore a condition called acute respiratory distress syndrome develops. And this limits the ability of oxygen to be transferred from the lungs into the blood vessels to be transported around to your body. Hence, patients will have a situation where oxygen desaturation occurs and the oxygen levels drop significantly. So this is just like a little cartoon diagram that shows what happens in the lungs. And you can see here, the virus itself attaches itself to the lung lining, and this triggers the immune system to ensue, and there's a war that goes on, if you like, in this little alveoli cells, and therefore fluid gets deposited in the alveoli, and that can, together with the inflammation, causes a reduction in oxygen transfer. And you may have read too that it is at this time where there are some studies reported where high-dose steroids have been reported to be beneficial. This is actually the point in time where steroids, high-dose steroids are administered. And the reason being is that high-dose steroids reduces or has the ability to reduce inflammation. And because it is this inflammatory response that is so activated that it's actually causing a lot of damage, and that's where steroids in this situation appear to have helped, and has been reported in several studies. But if the infection continues, you get a period where the infection or the virus then goes into the bloodstream, and then it affects the heart, and then subsequently the heart, which, as you know, sends blood around your body, goes to the brain, the liver, kidneys, and endocrine glands, and that's how it attacks other parts of your body as well. So no guesses in asking you to look at these x-rays, and I'm sure you can tell which is the normal x-ray of the chest, which is on the left side, and which is the abnormal x-ray on the right side, where you have a lot of fluid being deposited in those little cells in the lungs called alveoli, and therefore you have a lot of white haziness, as you can see here in this x-ray of a patient with COVID-19. In addition to that, also as I had alluded to earlier, the effects the virus has, or COVID-19 has, is that it requires, or it acts through the ACE2 receptor. And ACE2 receptor is also found in many endocrine glands as well. Not only that, but also the virus, by virtue of triggering the inflammation, can cause inflammation also in all these glands that you can see here. And that's how patients can actually develop problems with endocrine problems following an infection of this nature. So what are the symptoms of severe COVID? So severe COVID would be the situation where your breathing gets progressively worse to the point where your chest wall is feeling the pain, because what you're trying to do is you're trying to keep up with the low oxygen. So you start to breathe more, you work much harder, your chest works harder, it becomes tired, it becomes painful. The reduction in oxygen causes confusion, disorientation, and if it gets worse, it comes to the point where sometimes patients can be, they can find themselves unable to be aroused or not able to stay awake. And then you also develop what we call cyanosis, which is blue lips and face, again, because of the reduction in oxygen. And it is important to note that, as you know, many of the reports now have found that the patients that are infected, the risk factors are higher, especially in older age, and also in those patients with pre-existing obesity, high blood pressure, cardiovascular disease, cancer, and diabetes. So the question is, how do you who to test? Ideally, everyone, but that's not going to happen. So the Infectious Disease Society of America in 2020, in March, they have come out with a recommendation that all ill patients, frontline health workers, and those with known exposure. The Centers for Disease Control in the US now no longer recommends testing positive cases if those patients are still infectious. When to test patients, anybody with a suggestive symptoms as soon as possible. As you know, there was test shortages, so testing may not be possible for everyone. For those who are known to be exposed, ideally should be tested within the 5-day range of post-exposure, because that's when it's most highest yield that you will find the test to be positive. How to test? Well, only viral nucleic acid and antigen tests should be used to diagnose acute illnesses, not serologic assays. So at this moment in time, the US Food and Drug Administration does not have a test that is proved yet. Rather, it is available under the situation where it is needed, where there are several places where the need is higher. That's where you use whichever test that is available. We don't know whether one test is better than the other. How long before I get test results, depending on the type of test that you are given. Again, like I said, you don't have a choice. It really depends on where you're being tested and it's the type of test that you're being used to being tested. It can range from 1 to 2 days to even sometimes 2 weeks. What do you do when you're waiting for these tests? You have to assume you have the infection until proven otherwise. So that means quarantine, social distancing, and as long as you've been tested, you'll need to stay away from everyone, at least until you know the test has come back negative. How accurate? Well, the PCR antigen test is highly accurate, but there's also some caveats in that several different types of tests may not come back positive. And there are patients with positive tests, with persistently positive tests who are beyond 10 days from the initial positive test, but now no symptoms. These patients no longer need to be tested because they are no longer infectious. For patients with a high suspicion of infection, a negative test does not rule out infection. And so the important message is, although there are tests that you can be subjected to, you have to interpret these tests with caution. In my institution, there are several different types of tests, and I'm pretty sure that different places around the country will offer different types of testing. And really, you'll have to, when you're being tested, you'll have to go there, and you will have to, when you're being tested, it will depend on the type of testing that you are being offered. So I put up this slide because this is really for those of you who are Star Wars geeks like me, will know that the Force was there to help these band of people to defeat the dark side of the Force, to bring order to the universe. And now we have had many years where telehealth has been touted as a form of seeing patients because it has been very helpful, but we've not had much luck in getting telehealth until COVID-19, which has expedited the rise of telehealth, which now many places in the US certainly are seeing patients, and I'm pretty sure in Europe as well during this pandemic. And it's helpful because there are many advantages, as I have listed here now on this slide, which I won't go through in detail. They're pretty self-explanatory. And in fact, many patients in a survey have reported that they are more likely to choose a healthcare provider who offers telemedicine because of its convenience, although just like having advantages, there are disadvantages as well relating to this, to telehealth medicine. Not everybody is techno-savvy. Insurance hurdles can sometimes prohibit telehealth from being offered. There's also an issue with protecting medical data, user errors, care delays. There's also some issues with medical licensing in the fact that if a provider is not licensed in a state, certain states, at least before COVID, that provider will not be able to see the patient. Say a patient is residing in Washington State, but if the provider lives in is located, say, in California, they will not be able to see that patient. At least that was before COVID, but now this has been relaxed. We don't know whether after COVID these rules would be implemented again or not. But I think the thing that that has been most challenging is, for me as a physician, is the inability to fully visualize and examine the patient, because the examination part is crucial. But I think likely this telemedicine is going to remain, and this is really the future of the healthcare. And it's hard to put Jack back into the box now. But we'll see. CMS has certainly allowed the telehealth to take place, but things may change over the next few months. And this is really the diagram of what COVID-19 looks like. And I think many patients have that question of asking me, well, you know, is this, if a person is to consider pituitary surgery, is this a risk factor? And so for every pituitary surgery, we will be testing patients for COVID-19 before any pituitary surgery should be implemented. So yes, as you can see here, screen for symptoms and testing for COVID-19 for all patients preoperatively. Now, having said that, if patients require emergency surgery as defined by worsening of their vision, because of the tumor being large and that is pressing on the optic nerve, certainly emergency surgery is warranted. And as you know, patients with acromegaly do present with large tumors, and that is something that we have to take that into consideration. For those patients where the vision is less acute, there is a possibility that we can schedule surgery at a later date until this pandemic has got better. And in certain situations where if the patient is COVID positive, I am told that in some places surgery is done using the transcranial approach rather than through the nose. This is really an algorithm to show that what really drives the emergency or the emergence of surgery is really the effect the tumor has on your vision. So if you have an acute loss of vision, really a surgery needs to be performed sooner rather than later, and patients need to be referred as soon as possible. But if there is a subtle reduction in vision, there is a possibility we can wait a little bit. And this is an algorithm that was reported recently by a group that looks at the effects the tumor has on the optic nerve. And certainly for patients who have normal vision, surgery can be deferred at least during this pandemic. So again, the risks of those patients who are at risk of COVID, you can see older age, obesity, cancer, chronic kidney disease, those with immunocompromised state, heart conditions, high blood pressure, cancer, and diabetes. Now, if you compare this with signs and symptoms of patients with acromegaly, you will see that there is an overlap there. So patients with acromegaly have a higher risk of high blood sugars, they have a higher risk of high blood pressure, they have possibility of organ enlargement, particularly in the heart. There is also the effects of growth hormone on the chest wall and the spine, and also the upper airway breathing. There is possibly larger tongue that can impair the breathing, can cause more labored breathing. There's also sleep apnea, which is also more frequent and more commonly seen in patients with acromegaly. The effects growth hormone has on the chest wall can cause chest wall deformities, which can also limit the ability for efficient breathing. And all these are factors that has to be taken into consideration as well. The effects the tumor and the tumor has, and also after surgery, is that patients with acromegaly can develop hypopituitarism, which can cause other hormonal deficiencies, particularly like thyroid deficiency, testosterone deficiency, cortisol deficiency. So these symptoms of tiredness, fatigue, and weight gain can also occur in patients with acromegaly as well. So how does the infection COVID-19 affect patients with acromegaly? Certainly there are challenges with pituitary surgery, and therefore testing is important for COVID-19 before the surgery. If there is a possibility of deferring surgery that in a patient who is positive, I think that should be recommended. Factors causing reduction in oxygen delivery. Again, like I had mentioned too earlier, upper airway and chest wall abnormalities, or the presence of sleep apnea is also a problem too, in the fact that it lowers oxygen levels when you're breathing during sleep. The presence of adrenal insufficiency and the risk of adrenal crisis. This is huge. This is really one of the most important things that I will emphasize in the next few slides. And also other comorbidities like high blood pressure, weight gain, cardiovascular disease, diabetes, and also not forgetting the fact that patients with acromegaly can sometimes receive high-dose steroids, particularly for those patients who have a lot of joint pains, neck pains, shoulder pains from the acromegaly. They could be receiving steroid injections. These are high doses of steroids that can hang around for a long period of time. And as you know, steroid exposure can cause a reduction in the immune action and immune suppression, and increase the risk of infections as well. And sometimes it can also suppress your adrenal function as well. So these are the things that can cause the risk to increase in patients with acromegaly. So if there is no visual compromise, like I had alluded to earlier, in a patient who is diagnosed with acromegaly, it is reasonable to consider treatment with medications initially, at least to control the condition, and then hopefully to defer surgery until the pandemic improves. And during that interim period, close follow-up visits with telemedicine is something to consider to reduce the exposure of coming into the clinic for hospital visits. However, if the visual compromise is noted over time, then certainly surgery is recommended. And again, that is a discussion that has to be made between the patient and the surgeon. And the aims for initial medical therapy for patients with acromegaly, if surgery is deferred, is that there is a possibility that medicines can actually improve some of the soft tissue swelling, particularly in the neck, which might help with sleep apnea and also might help with intubation during surgery as well. So there are some benefits if treatment with medications are instituted before surgery. And certainly for patients who have sleep apnea, chest wall deformity, upper airway obstruction, or intrathoracic collapse, or upper airway obstruction due to the large tongue, certainly those patients who are treated with CPAP should continue CPAP and should not stop the CPAP unless there is a worsening of the respiratory symptoms, for which then emergent medical attention should be sought in order to determine what the cause is of why the respiratory symptoms continue to worsen. So I'm going to spend the next few minutes talking about adrenal insufficiency because this is a very important topic during the pandemic. Patients with adrenal insufficiency, as we know, they have a higher risk of infections. And this is not even without the pandemic. So any patient with adrenal insufficiency, studies have reported there is an increased risk of infections. They are more susceptible to infections. And the infections can trigger adrenal crisis and also a suppression of the immune system. So important that you wear a medic alert bracelet to alert the paramedics, if you are found unconscious and you require steroids in a situation where you need to be resuscitated with steroids, high doses of steroids. But otherwise, most patients who have adrenal insufficiency are on hydrocortisone or prednisone, and it's important that they are aware of the sick day rules and prompt stress dosing when they feel that there is an infection coming on. During the pandemic, we may not be able to leave our homes, and certainly during lockdown, so it's important to ensure that there is sufficient medication supply at home so that medications do not run out. If patients who are at home, very important to make sure that you monitor your symptoms, particularly fever, and if your fever is worsening, you may have to not only double your dose of steroids, but you might even have to increase it to a much higher dose. And I've given you some pointers here. So you might have to increase your hydrocortisone dose if you're on hydrocortisone to 20 milligrams every 6 hours. If you're on prednisone, 10 milligrams every 12 hours. Important to rest and drink regularly to ensure that you're not dehydrated, because fever can precipitate dehydration because you're losing insensible fluid loss. Monitor how much you're urinating. Obviously, you can, if the fever is making you unwell, you can take some Tylenol, or in the UK, it's paracetamol for fever, and seek medical attention early. If clinical deterioration continues, I hope that most of you would have injectable hydrocortisone to be given and seek medical attention urgently. But make sure you have that injectable device at home that you can administer, especially if there are any issues like if there is a delay getting to a hospital, you might need to take another 50 milligrams of hydrocortisone and ensure good hydration before you get to the hospital. So this is like a figure that I'm showing you here, where if you move from left to right, you'll see that viral load or viral infection starts, and then your body starts to produce more inflammation, and the inflammation continues to increase. You can see that in the early stages, if there are no symptoms, no fever, it's important that you can still stay at home, maintain social isolation, but ensure that you have the injectable solid Cortef or injectable hydrocortisone handy at home in case you need it. If you have mild symptoms, as I have listed here, or if you have a mild fever, you need to double your dose of steroids. And if the fever continues, you might even have to increase the dose to 20 milligrams. For those of you taking hydrocortisone, 20 milligrams every 6 hourly, or prednisone, 10 milligrams every 12 hourly. But this is obviously only applicable to patients who are able to swallow, because if you have nausea and vomiting especially, and you're not able to swallow your steroids, you have to make sure that you get to the hospital because your steroid administration has to be given to you intravenously. Any other worsening symptoms and the onset of pneumonia requires urgent hospitalization, so there is no delay. That should be, you should be getting yourself to the hospital ASAP, and in the hospital, intravenous management is recommended, where you have intravenous hydrocortisone, and also because this illness is also can cause clots to occur. Blood thinning medications may sometimes be needed in order to reduce the risk of blood clots. This is really the worst case scenario, where you have the ARDS, or acute respiratory distress syndrome, and you have changes on x-rays, the oxygen levels are continuing to reduce, and this is where certainly ICU admission is warranted. So you can see here there are different stages in this infection, and that requires different types of management and treatment regimens. For those patients who have diabetes insipidus, say because of the surgery or because they had a large tumor and they are now pan-hypopit as a result. This is also a risk for dehydration, especially from the fever, diarrhea, and vomiting. You may need to increase the fluid intake and make sure you might need to underdose the desmopressin slightly, because if you're not able to get to a center where you can have your blood tested, the concern is if you take too much of it, you can actually lower your sodium levels, which can also be dangerous. So it is okay to urinate slightly more, but make sure you compensate to drink more, okay? For patients with other types of hormonal deficiencies, that is less affected by COVID. So for thyroid, no dose changes are needed. For testosterone, no dose changes are needed as well. And certainly for those patients who are on growth hormone, and I do know that some acromegaly patients are also on growth hormone because they have developed growth hormone deficiency, especially for those who have had radiation. And if you are now on growth hormone is certainly no dose changes are needed. But those who have growth hormone deficiency suspected, further testing can be deferred at least to a later date. Other types of comorbidities associated with acromegaly is really no different. Treat as you normally would do. So for blood pressure control, blood pressure needs to be optimized. So is other cardiovascular risk factors. And anticoagulation or blood thinning medications may need to be considered if there is a risk of blood clots. For patients with diabetes, it is possible that your diabetic control could get worse during the infection, and certainly it's important to maintain contact with your diabetes specialist. And you may need to increase your medication doses, like for example, like your insulin doses, and you may need to test yourself more frequently as well. For those patients on steroids for a number of reasons, particularly if you are taking a lot of steroid injections, if it is possible, you may need to limit the steroid doses because, like I said, steroid injections exposes your body to high levels of steroids, and that can also be detrimental in increasing the risk of infections. So the take-home messages are that the pandemic has impacted the way we as providers provide care and also patient attitudes. And to a certain extent, especially in certain parts of the world, it has also limited access to testing and treatment. Despite COVID-19, patients should still seek medical attention, especially for those with symptoms that are getting worse. And this is important to minimize delays in diagnosis and instituting management, because this is very important, especially for those who have adrenal insufficiency on steroid replacement. If you think that you may be exposed to the infection, you should be tested for it, and repeat testing is important if prior results were negative, but symptoms continue to persist. It's important for patients with acromegaly to be very vigilant to their breathing and symptoms of adrenal insufficiency, and also for the fact that if their symptoms are getting worse, such as their fever, or they're getting more breathless, or they're getting more confused. During this time, it's important to adhere to daily medications, but because of the changing environment and because of the potential that you might need stress dosing for your steroids, it is important to adapt to the increased replacement doses. And then finally, it's important to ensure that you maintain contact with your provider, and you might need to be even seen more frequently during this time, even if it's just for a touch base to see whether your medications should be adjusted or not. It's important that this is done your blood pressure to be monitored, and importantly, to maintain adequate hydration. With that, I'm thanking you for your attention, and I'm happy to answer any questions that you may have.
What a great talk. Thank you, Dr. Yuen. Does anyone have any questions? I know that we've had several patients that have been affected by COVID-19. Mm-hmm. You know, and luckily, I don't know of any that have passed because of it, but I know that they really, it was devastating.
Yes.
And you know, having to deal with one chronic condition and then adding this on top of it just made it so much worse. Yes. So let me see. Does anyone have any questions that they would like? Could you type in the chat and I will unmute you to let you know?
I think while you're doing that, I can say a common question I get asked, and I think Jill, you asked that question too, is during this period, especially for patients who have recently had pituitary surgery for their acromegaly or for any pituitary surgery through the nose, you know, is it still okay to be tested with COVID with that swab going through their nose? And the answer to that is it is preferable to avoid sticking, you know, those swabs right to the back of the nose, because, you know, surgeons have, you know, when the surgery has it's gone through the nose, so the area could still be raw. So if you are being tested or if you're considering to be tested, make sure you tell the people who are testing you that if you've just had surgery or you've had recent surgery through the nose, that they should be testing you by other means. It could be a blood test, or I'm told recently they could have something now that they could put saline into your nose to rinse it, and then they could collect that collection of saline to test you for COVID. So there are ways to get around it apart from putting that big swab right to the back of your nose, okay?
So can I ask, is that just for patients who have had recent pituitary surgery, or is it, what about patients that had pituitary surgery years ago?
Yeah, well, the hope is that if you've had surgery many years ago, the hope is that, you know, that area, that little hole is all plugged up and it's not going to be affected. But it's difficult to say, because what you're doing is that when you're putting that nasal swab, you're really going right, it's quite far in, you know, and there is always a risk that you could puncture that hole. So, so I would say, especially for those patients with recent surgery, but I think even if you've had surgery in the past, I think it's important that you inform the tester that you've had surgery in the past, and preferably if you are being tested, it would be preferable to do it with other means rather than that nasal swab.
So one of the questions on the list, there's someone that is finding it difficult. They get growth hormone injections due to being growth hormone deficient. And genotropin MQ is unavailable. Is there a different growth hormone that you are substituting for patients since the genotropin is unavailable?
So here, especially in the US, and as you know, genotropin or any growth hormone product is expensive. So if there is a product that is unavailable for whatever reason, then it is very important that you talk to your provider to get him or her to apply for you to get insurance approval for another growth hormone brand that is available. Now, obviously it's preferable that you keep on your growth hormone injections as much as you can. But from the COVID standpoint, even if you miss growth hormone for a few weeks, it's not detrimental. But I know for some patients, if they miss growth hormone, they do feel more tired and more lethargic. So I think it's important that you notify your provider and make sure that they apply for another growth hormone brand for you in order for the insurance to approve for you to be given an alternative growth hormone. And alternative growth hormone brands would be Hemotrope, Norditropin, Neutropin, Omnitrope. So those are the ones that you could try, which ultimately it really depends on the insurance coverage for the type of growth hormone that you are taking.
Thank you. So there's someone that had recent pituitary surgery, and during the surgery they had a CSF leak. And they're wondering if there's, now that they've been discharged, is there any additional recommendations because they did have this recent CSF leak? I know that a CSF leak, if not packed properly and stocked, can lead to higher incidences of meningitis and other things.
Yes, it's very important that if you do feel that there is still a leak going on, then you have to make sure you contact your surgeon because they can do a test to see whether it's a leak versus it's just nasal fluid coming out. So it's very important to differentiate. So it's very important that you contact your surgeon and to get him or her look at it and assess it, because if it's truly a leak, that needs to be closed up the sooner the better, because as you're right, Jill, it almost opened a can of worms for all the bugs to go in, and meningitis is really not going to be pleasant. And so that's why you need to close it if it's truly a CSS leak. But the important thing is to make sure you get tested to see whether the discharge coming out from your nose, is it CSF or not.
Okay. There was a lot of patients that thanked you for this presentation and such useful information. Another person said, when we have to go for emergency pituitary surgery and knowing there are COVID patients in the hospital, what are the precautions taken to ensure the patient is safe from COVID?
That's a tough question. I mean, emergency surgeries have to take place depending on the level and the severity of the condition. So ideally, if they have a test where they are able to test the patient to see whether the results can come back within a day or so, that would be extremely helpful. But in the worst case scenario, if you don't, say for example, if the patient has COVID and requires emergent pituitary surgery, that is where the consideration for a craniotomy might have to take place, because the intubation part of the process is really where there's a lot of that potentially there could be a lot of exposure of the droplets to the healthcare professionals or to healthcare providers in the OR. But otherwise, if most hospitals would be practicing the necessary preventive measures, PPE, and all that all the good stuff. And if it's emergency surgery that has to be performed emergently, then they have to do what they have to do, really. But ultimately, if there is any possibility that they can delay the surgery and get the patient tested, then I think that would be preferable.
Now, correct me if I'm wrong, but don't they put all the COVID patients on one floor to try to keep it contained?
That's certainly true for my hospital, but again, it really depends on the geography and for different parts of the world and different hospitals. But in my hospital, yes, they have a specific COVID wing where the staff and all the PPE, they're all there. But I can't speak for other hospitals and other healthcare facilities.
Okay. And anyone else with any questions? Let's see. This person said, thank you very much for this very useful and comprehensive presentation. Another said, thank you, Dr. Yuen. This information is invaluable. This presentation was great. Thank you so much. Another, thank you so much for this useful presentation, and thank you. You know, our patients have been coming to me for some time, and as you know, I sat in on a talk by you a couple weeks ago, and we can't thank you enough for giving our community this talk. Because at the end of the day, we have to do what it takes to protect ourselves.
Absolutely. And I think one thing that compelled me for doing this and for being so actively, and I also did a podcast as well in the Pituitary World News as well, is because I think pituitary patients, especially you know, for those with acromegaly and Cushing's, they're almost like we don't get the media attention as much as patients with high blood hypertension, patients with diabetes, patients with cancer. It's almost like these types of patients are almost like the neglected or the forgotten types of patients. So I think it's very important that we have a strong voice in and also giving patients like that the recommendations and also to tell you that you're not forgotten, at least to me anyway.
Well, I want to thank you again, Dr. Yuen, and I hope everyone enjoyed this talk, and we will see you again next month for another Education by the Experts. And thank you again. We've got more people saying thank you. So once again, we truly appreciate you. Thank you for your commitment to patients, and stay safe and healthy.
Stay safe, guys. Take care.
Thank you.
All the best. Bye-bye.